Good morning, good afternoon, good evening, everyone. It's so good to be with you. Welcome to World Humanitarian Day. My name is Craig Redmond. I'm the CEO of Relief International, and I'm so happy to be with you all this morning, my time. Also, a big hello to all of you who are going to log in later and watch this presentation. I'm so pleased to be with you today. We have a great conversation set up with you, with some of our humanitarians calling in from Sudan. And before we get to that, before I make some introductions, I do want to say a few things about what is World Humanitarian Day. Well, this is a time when we pay tribute to those humanitarians around the world who are doing incredibly important work day in and day out, sometimes under extreme conditions, like those you're going to hear about today that are happening in Sudan, in this case in North Darfur, our team calling in from there. We really honor those humanitarians around the world who do this difficult and incredibly important work. So thank you all so much for being with us. Again, before I make some introductions, let me say a couple of things about Relief International. We are an international humanitarian organization. We work in 15 countries around the world. We are about 6,000 people strong, which is a big number. That's a combination of people who volunteer with us and people who work directly with us as an organization. We partner with communities impacted by conflict, climate change, and disaster. Oftentimes, those are those rapid onset disasters, natural disasters, things like that. And we work in those places and those times to save lives, to build greater resilience, and promote long-term health and well-being. And what that means is that when an event happens, we're there to respond to that event, but we stay longer term to help strengthen the system that's so critical, so communities and families can be more resilient and have the systems in place so they can get on with their lives. Oftentimes we work in primary healthcare settings. We strengthen those systems so families know where to go, who they're going to see, which doctors, nurses, and healthcare professionals they're going to visit. So important to having a more resilient life. And you're going to hear from our team members who do that very quickly. Our colleagues, as I said, are in North Darfur right now. You can see some of them, hopefully, on the screen, and we're going to be talking to them. I will say that we're having some technical difficulties because they are calling in from North Darfur. So stick with us as we work those through and any little delay we have. By the way, anytime you have a question, you can put it into the chat. And Joe, who's behind the scenes, is going to feed those questions to us so that we can make sure that your questions get answered by our team there. Let's get straight to our team. Let me make some introductions here. We have with us on the call Dr. Mohammed Ibrahim Adam. Dr. Ibrahim is our doctor in Zamzam Camp. Zamzam Camp is a IDP camp, internally displaced person camp, just to the south of El Fasher. We also have Altagani Adam with us. Altagani is the area manager in North Darfur. We also have Dr. Quresh Sarwanja with us. He's the deputy country director, and he's based in Port Sudan. And then facilitating our conversation, we have Lydia Mutambanyoka, who's with us calling in from London this morning. She's our humanitarian director. I can't tell you how proud I am to have this incredible team with Relief International doing this valuable work around the world. As you all know, Sudan right now is the world's largest humanitarian disaster with over 10 million people displaced and massive challenges across the country. We have a brilliant team. We're so happy to have some of them with us here today. And Lydia, thank you for hosting this conversation, and let me hand it on over to you.
Thank you very much, Craig. It's such an honor and a privilege to host these amazing humanitarians. And maybe before I get into the panel questions, I'd just like to give a huge thanks and appreciation to all the frontline workers we have in Relief International who are working in all of our country offices. I'd like to wish you all a happy World Humanitarian Day. And also just to say, we want to take time to remember all of our colleagues who've also lost their lives in the front line whilst they are helping affected communities in the countries that they are working in. I also want to do a big shout out to all the team in Sudan. We really appreciate all the work that you're doing and also everything that's been happening in the country. we continuing to give all our support to you. So we're looking forward to hearing from you and also learning from you around what's currently happening in Sudan and also how you're able to cope. As you know, the theme for this year's World Humanitarian Day is Protect Humanity and Act for Humanity. So we're looking forward to hearing from you and learning from you. So my first question is going to be to Dr. Quresh. Dr. Quresh, what are the most significant challenges that you are facing in terms of delivering support right now?
Thank you so much, Lydia. Good morning, good afternoon, good evening, everyone. Interesting question. Of course, Lydia, right now, I would say there's so many challenges right now in Sudan facing the healthcare system and the entire humanitarian system. However, I'll try to be so brief and focus on very few key ones that I feel are very, very important at the moment right now. I'll give an example of El Fashi, where the entire healthcare system, the secondary healthcare system, has collapsed. I can comfortably say that it has collapsed. Prior to the conflict, we had about 5 functioning hospitals within El Fashi alone. Remember, El Fashi is the capital city of North Darfur. As I speak right now, we only have 1 hospital remaining, and this hospital has been attacked to a level of almost 20% capacity. Of course, it has brought a lot of challenges to the primary healthcare centers because we've started seeing cases that are meant to be managed within the high dependence unit of the hospital, even intensive care units being sent to the primary healthcare centers, which of course we can't do much at the primary healthcare center level. Relief International is trying as much as possible to coordinate with the state ministry and the Darfur Health Cluster to try and see how best to support this. We've tried to, the state ministry has identified new buildings to try and house the existing hospital, which is the maternity hospital. This hospital was initially meant to only support maternity cases, but because of what is happening right now, all the other departments are within the hospital. So we are trying as much as possible to see how best to support this, and we hope that we shall be able to have support and be able to fund the new premises, and we hope that even the new premises will not be affected. Lack of access, and this has not only affected delivery of supplies, but also our health staff being able to access these primary healthcare centers and be able to deliver the much needed support. Of course, with limited access, we've seen a lot of increase or an increase in the number of severe acute malnutrition cases. I'll give you an example. In May, we had about 781 severe acute malnutrition cases. And right now, as per July data, we had about 1,500 cases. And this is only in 7 sites within Zamzam IDP camp. Of course, without supplies coming in, or with supplies coming in with limited amounts, you have cases of moderate malnutrition moving to severe acute malnutrition, and then, of course, you have an increased risk of death. Besides the nutrition supplies, we also have shortage of medical supplies because we are having challenges with the crossline and the cross-border movements. So that has really affected supplies reaching very critical sites like El Fashi, and of course, leaving us unable to even treat cases as simple as diarrhea in some of the health facilities because we do not have these much needed supplies. I'll give you another example of supplies as simple as gauze. Last weekend, we received over 50 trauma cases, which are meant to be seen at the hospital, and they were sent to our Zamzam clinic. Of course, our team did whatever they could, but of course, without supplies, we had to refer those cases to the hospital. But we also know we referred those cases to the hospital, but nothing could be done at the hospital because the hospital infrastructure is also down. They also do not have supplies. The other point is that, of course, attack on the health facilities. We've had 2 of our health facilities attacked within El Fashi to a level of not functioning. Relief International has tried to mitigate this by trying to set up 4 mobile clinics within El Fashi to ensure that there is increased access to care for the beneficiaries that might not be able to access care because of damage to the health facilities. Of course, setting up mobile clinics will increase access to care, but without the much needed supplies, our team are left helpless. You have caseloads as high as 11,000 in only 3 of our 5 clinics in Zamzam in July. That is a number that we are not used to. Prior to the conflict, we would see about 4,000 cases within our 5 clinics within Zamzam. As per July, we had almost 11,000 OPD consultations. Of course, for some of these, if we do not have supplies, we shall do the little that we can, counsel, advise on what to do next, and then write the prescription. But as we write the prescription, we well know that these patients will not be able to buy because cash is also an issue. Even getting open pharmacies within El Fashi is also impossible. Yesterday, we had our medical warehouse attacked. And that has been our lifeline because whatever supplies we get, we try as much as possible to keep them and release a little at a time. Confiscation of our supplies by conflicting parties has also further affected our service delivery. Lastly, are the heavy rains that have also caused more damage, both to the infrastructure and also access as well. And they've also increased the risk for waterborne diseases. I'll give you an example of Almanaji locality that is in Jazeera State, where Relief International is the only agency that is providing support. Cholera has been confirmed within Jazeera State and Almanaji Rural Teaching Hospital. Cholera treatment center has been set up, but we cannot get supplies to Almanaji. Of course, we are coordinating as much as possible with WHO to make sure that we can try. WHO has the supplies ready, but without access, will not be able to bring in this much needed support. And of course, that means more cases will come up because we can't do much awareness. Even if we did awareness, we can't still deliver the much needed IPC supplies. So, Lydia, I can go on until tomorrow. It is really a lot, but we hope and pray that the situation improves.
Thank you so much, Dr. Quresh. So I worked in South Darfur in Nyala 20 years ago now. And actually, when I asked you what the challenges were, actually, these are huge challenges. So just to recap on some of the challenges that you mentioned, the secondary healthcare system has collapsed. There's lack of access or limited access. There's huge shortages of medical supplies, and there's heavy rains. There's also risk of waterborne diseases. Cholera has been confirmed, and also another huge blow as the Relief International warehouse was attacked yesterday. So that is surmountable challenges. So this leads me to the next question that I would like to ask Dr. Ibrahim. With all these challenging conditions, how are these challenging conditions, Dr. Ibrahim, impacting on you emotionally and psychologically? Do you have tools to help you cope and build resilience? And if you do, would you be able to please share those with us?
Thank you, Alida, for this chance. Yes, here are displaced from Al-Fasha to Zamzam camp, and we left all things behind, even our IDs. Yes, we still recalling our colleague. He is active ambulance driver, Musa. He passed away when while he referring a patient, a pregnant lady in labor, to Zalfashir for the surgical intervention. Yes, fear here is the dominant feeling that affecting most of us. Our colleague here fear from gun shooting because they're working under bombing and under gun shooting their house. Usually on daily basis, we heard bad news. Some of our colleagues, their house were destroyed in Al-Fasha. The children were injured in Al-Fasha. Yes, some of our colleagues started to develop hopelessness due to the dark future in Sudan. Yes, we have some tools or some coping mechanisms we're practicing here to relieve some stressful psychological effect on us. like we supporting each other, and also we avoid weird news that make us panic. Also, we involving ourselves mainly in good positive things and in delivering services to our community. The good things that we have psychologists and medical doctor, psychiatrists in our team that providing psychological services for colleagues that in need here in Zamzam. Thank you.
Thank you, Dr. Ibrahim. And just to recap some of what you've said, which is really dreadful for you to experience on a daily basis. You've mentioned that a lot of you have been displaced to Zamzam camp. You left everything behind, and I'm sure you don't even know the state of your homes. You've also mentioned that fear is dominant amongst most of the communities and that there's a growing sense of hopelessness. And also you mentioned our colleague who we sadly lost in line of duty, Musa Ibrahim Suleiman. And I'm pleased that you've also mentioned some very helpful tips that even us who are not in the front line can also use to be able to cope, especially when we see the news of everything that's happening around the world. You've told us that you support each other and that you focus on delivering services to communities, but it's also good to note that there's psychologists who are available and offering some psychological support to all the team. So thank you very much for sharing those tools and also shedding light in terms of how you cope and build resilience. So I'll now move to Altegani with my next question for him. So Altegani, this is an opportunity for you to please share with the rest of the world any message that you'd like them to hear, especially on World Humanitarian Day. So what message would you like to share with the international community on World Humanitarian Day?
Thank you very much, Lida and the team. For me, I can say that within this very difficult period, we are able to deliver what we have here in North Darfur, especially through the teamwork in Relief International. Really, we are able to deliver what we have. I can say that immediately we can require the ceasefire, and we also need to require the deployment of supplement from the humanitarian aid to respond the gap we have here in North Darfur. Because the North Darfur among the states is one of the very affected area in Sudan, and only there are few organizations there still working and operating here. Even really, I can say that most of the organizations they relocated their staff even outside of the Sudan, while RI is still there struggling and respond to the. That's why we shift our office from the Fashir to Zamzam and operate for the two purposes. The first one, we need to secure ourselves and our colleagues. At the same time, we need to make that ensuring the service and the people in need they can have in the project and the service we are providing, including wash, nutrition, and health. And also we have the good coordination with the State Minister of Health and HAC and the government, so that they're saying that Relief International Health Facility in Zamzam, it's like backup for them, because in Fashir City they have only one health facility as the corporation mentioned, which is the maternity hospital, and all of the department now running to that office, to that maternity hospital. So that's why we are strongly coordinating with them, responding to the humanitarian aid. For example, last Saturday there is a huge attack for the Fashir City, and people are running to our health facility, and our team at that time, they are doing amazing job. You don't know even who is a medical doctor, who is a nutrition officer, who is a wash assistant, who is a wash manager. All the team engaged to respond to the people there. So in the other hand, we also have a coordination with the state government, state Ministry of Health, to make sure that we are delivering fuel or even to the military hospital, water tank to the hospital also. That is ongoing, but we still have the gap. I also do request the fund, which should be flexible fund to respond immediately instead of waiting for the long process which you have internally. Thank you very much. Any question, you are welcome.
Thank you so much, Al-Tagani, for that. I just want to recap what you've mentioned. You've said we can only deliver what we have, and therefore there's urgent need for deployment of more supplies to cover the gap. And also you're calling on a ceasefire. You've also mentioned that there's a few organizations that are currently working in Fasha and also in Zamzam, and that Relief International continues to do WASH, nutrition and health programs. I want to also join you in commending and thanking the team who did an amazing job last weekend. We're able to see some of the photographs in Zamzam camp of how the team was able to receive wounded people and also give them assistance. And then finally, you've mentioned that there's need for more flexible funding to enable responding to the needs as they emerge. So maybe I'll just open up before I hand back to Craig, if Dr. Ibrahim or Dr. Quresh have anything else that they would want to share in terms of key messages that you want to share with the international community on this day today, the 19th of August, World Humanitarian Day. So maybe we'll start with you, Dr. Ibrahim, if you have anything to add, and then Dr. Quresh.
Yes, Quresh, and after you, I will.
Thank you so much, Lydia. I just want to emphasize the point of the Elifashi Maternity Hospital. As we all know, Zamzam IDP camp alone houses over 500,000 residents. And of course, hospital care is a lifeline right now where we expect a lot of complex injuries that cannot really be managed in the primary healthcare centers. Relief International right now is coordinating a task force that has been added to the Darfur Sub-National Health Cluster. Of course, in this task force, we have a few NGOs that we are working together with within El Fashi. We've tried to map the needs. And you can't imagine that out of over 4,800 barrels of water that are needed a month, we can't even fund a third of that. Out of the 53 barrels of fuel that are needed a month, at the moment, we can't even reach 80% of that. So echoing on the point of Al-Tagani, flexibility in donor funding, I would like to appreciate a few of our donors that have really tried to be a little flexible, but we still advocate for more flexibility. We currently have a number of changes coming into the context. You have most of the members or most of the community leaving El Fashi, moving to Zamzam, or leaving Zamzam or El Fashi, moving to Al-Maha. So if we feel like a donor approved our funding for El Fashi, but many people have left and have gone to Al-Maha locality where there is no funding available and the needs are really huge. So all we need is to kind of make the approval process a bit less strict so that we are able to provide services immediately and be able to provide that much needed people-centered care that is the focus of Relief International. The other point is the issue of emergencies. Of course, with the current situation, limited access to clean and safe water, with the flooding season on, you expect a lot of waterborne emergencies coming up. Right now, we are in touch with the State Ministry of Gedaref State. There's a suspected polio case. And of course, EPI vaccines are almost impossible to have access to them right now in states like Darfur. From Gedaref, we do not want to hear that a camp like Zamzam IDP camp has a polio outbreak. So we are trying as much as possible to seek flexibility. We are trying to see if we can bring in EPI fridges and be able to have vaccines stored within a few satellite health facilities so that we are able to provide these much needed vaccinations. So as I said, there's a lot, and I think I can talk till morning, but a ceasefire, flexibility in funding, and of course, more funding and negotiating for humanitarian corridors so that we are able to bring in supplies is on the top priority for Relief International right now. Thank you.
Thank you so much, Dr. Quresh, and thank you for summing up those key messages for everyone. So a ceasefire, humanitarian corridors, approval processes which are faster and more flexible funding. So thank you so much for that. Dr. Ibrahim, do you have anything else that you maybe want to add?
Yes. Now here, our team in Al-Fasha, especially in Zamzam camp, providing integrated services for our community, health, nutrition, and wash, especially in health. We're providing the primary health care, and in sometimes even the secondary health care will be handled by our team, because sometimes when the shooting is ongoing there, no secondary healthcare services will be in Al-Fasha. So I'm very trustful for our international community that to help us to receive our supplies from outside Al-Fasha, because till now we cannot able to receive our supplies from outside Al-Fasha. Even the supplies that use it for the treatment of the injured patient, which is the top emergency patients. Also, I'm trustful on international community that because here now our beneficiaries or total beneficiaries in Zamzam camp is exceeded almost 3 or 4 times the targeted that for the project, due to the ongoing internal displacement from Al-Fasha to our intervention areas. So please for international communities to help us to expand our services and to get more funding so as to meet the huge gap in the humanitarian aid for Sudan, and especially for Al-Fasha and Zamzam camps. Thank you.
Thank you so much, Dr. Ibrahim, for that. So definitely you need the international community to know that we will continue and need assistance to provide integrated services, primary health care. Also, there's urgent need for supplies and also support for secondary health care, but also calling out for support for Relief International programs to expand the services, because the population in Zamzam camp is now 3 to 4 times what it was initially and what is covered by ongoing projects. So there's a huge gap there and needs that remain. I'd like to really thank you, Dr. Quresh, Altegani, and Dr. Ibrahim for sharing your insights, but also shedding a light on the challenges that you're experiencing, how you're able to cope, and also just helping us to understand what are the key messages that need to go out to the rest of the international community around Sudan at the moment, but also in particular Al-Fasha and Zamzam camp. I'll now hand back to Craig. So over to you, Craig.
Thank you, Lydia. Thank you so much, Altegani and Dr. Ibrahim, Dr. Quresh, for a great conversation. We're having some questions come in from people watching, and as they do, one thing I wanted to ask you, Altegani, here's a question for you. Yesterday, we understand that our warehouse, as you mentioned, there was a shelling and our warehouse was damaged and we lost some medical supplies. I wonder if you could say a few things, give us some details about what happened there and what we're trying to do about that.
So, thank you very much for question. That is hitting happened yesterday evening, mainly in our medical warehouse, and there is a damage from outside the house. The main door at the windows removed it, but There is 3 cars also committed totally, ambulance, and two cars belong to the security guards. And for the medicine, not yet we verify it, because we need to have like security approval from our team. And this morning we already having the meeting with the CD and also the other members, SMT members. So that is for us for tomorrow. Initially we have some information, but we need to verify the size of damage tomorrow morning. But our plan also is we just need to immediately move this medicine to somewhere, even maybe to our main office there, and then we are trying to also find some areas here in Zamzam to get and transport this medicine to Zamzam right now, because shielding is not stopped. We can expect the same thing to happen also in the future. Thank you.
Altagani, thank you so much. It's an example of just how dramatic things are there, that our warehouse itself was hit by a shell and family members were injured in that. I'm so sorry to hear that. Quresh, Dr. Quresh, I have a question for you. At Relief International, we talk about the fact that 98% of our team are national, meaning they're from the places where we're working. In the context of Sudan and in the context of North Darfur, what does that mean? Why is that important? What are the implications of that fact?
Thank you so much, Craig. And I think we even had a discussion yesterday in one of the meetings, as we were kind of working on our strategic plan for the next 3 years. Yes, this has been a very great lesson for us, and we've really appreciated the importance of using staff that are native to the areas where we are operating, because as many agencies lost their staff relocating to areas where they come from, we were able to have services continue. And this was one of the factors, because we hire almost, I would say not even 98, I would say almost 99% of the staff that come from areas where we are currently operating. The other factor is that even for staff that might not be coming from those areas, the staff that come from the areas that we operate are able to provide support as simple as shelter, which is very important, because we have staff that might not be native of the areas where we serve, but because they might not have shelter, they're forced to relocate. But we've had cases of native staff providing support to the staff that might not be native of those areas, and that has further made us continue to provide services. The other key factor is community ownership and trust, because the community feels like this is our son providing support for us, and we have to do whatever it takes to make sure that we also come in and support. We have very many volunteers that have come in to support our work within Zamzam. We work with community-based protection networks that have not paid a single coin. We work with village health committees that have been very instrumental in us setting up mobile clinics within Zamzam, El Fashi, and other areas. We have community nutrition volunteers that are very key with the current situation in Zamzam, where famine has been declared, and these are basically not being paid anything, but they're working and risking their lives. So it has been a very key factor, and we really hope that we move 98% to almost 100% of hiring natives in the areas that we operate.
Amazing. Thank you, Dr. Quresh. Very interesting and very important. We have a question here from Sarah. I'd like to know, how many health facilities does Relief International have in North Darfur, and what specific support are we providing through those health facilities? I wonder, Dr. Quresh, maybe back to you for that question. How many facilities do we have in North Darfur?
Thank you so much. I'll go locality by locality. Right now, we are functional in 3 localities within North Darfur. Within El Fashi, we have 17 health facilities, and that is really a huge number, given whatever is happening. And being that Relief International has been able to keep all these 17 health facilities functional, I would say it's a big thank you to our national team and our international community that are supporting our efforts. Within Malha locality, we have 10 health facilities, and then within Melit locality, we have 6 health facilities. So in total, we have 33 health facilities. If I include El Fashi Maternity Hospital, that will be 34. In addition to those, we have plans to further expand within Tawila and Tawisha because of the several requests from the State Ministry and the beneficiary representatives that have really come up to Relief International to make sure that we provide that much needed services. As approach to our service delivery, we ensure that we provide integrated services to ensure that when a beneficiary comes to our project site, they're able to get all the needed services in one site. Of course, we know access to care is really a big challenge. Transportation is a big challenge. So we do not want a beneficiary to come to a project site and then they're only able to get 1 or 2 services. So in all our project sites, we are able to provide an integrated primary health care package that includes reproductive health services, EPI services, malnutrition services, including outpatient therapeutic program, stabilization center or referral of stabilization center cases, targeted supplementary feeding program, and then also we've incorporated mental health and psychosocial support. We all know what is happening right now in Sudan. Mental health and psychosocial support is very key on the agenda. So we also provide WASH within health facilities and also WASH in the community. So it's an integrated package. And thanks to some of our key donors, we have also started food security and livelihood. Given what is happening in Zamzam IDP camp, we have started a program to support the communities that I need with a voucher program. So we ensure that an integrated approach is incorporated across all the project sites.
Great. Dr. Karesh, thank you so much. WASH being water, sanitation, hygiene. Here's a question for Dr. Altagani. For Altagani, reports indicate there's cholera outbreak combined with malaria, dengue, and other vector-borne diseases, which are mostly WASH-related. How do you explain the humanitarian WASH situation and the damage on the infrastructure in North Darfur? Altagani, over to you for that question.
Thank you very much. Regarding the WASH facilities in North Darfur, already we and the other organization engaged the State Ministry of Health to assess the damage happened, especially in Zamzam IDPs, and there is already ongoing assessment by the team. So we are expecting that already they are starting to see the way how they can make intervention regarding this. So while WASH sector are already aware about this one, and they are going to respond also very soon. This, including the latrines and household damages, and also latrines, and people already they are in need regarding the non-food items. So I think there is response will come soon. If Dr. Mohammed need to add anything,
yes, for the waterborne disease, here in Darfur and in Sudan, we have the malaria, cholera, and dengue fever. They are seem to be endemic diseases in our community here. Yes, last year, all of these are endemic in our community, and also we started to catch up these diseases last year. But for this year, for the malaria, started to appear within these days, first days of August. But dengue fever till now we will not reported dengue fever in our registrations. For cholera, yes, we hear that there is a rumor of cholera diseases in the Zamzam camp, and we have a coordination with Ministry of Health here. We visited the area of a rumor. We investigate in coordination with SMOH, but the investigation confirms that no cholera now reported in Zamzam camp. That has happened 3 weeks ago. Nowadays, we raise our reporting and our surveillance, and we opening our eyes for those 3 diseases, especially cholera. We still monitoring our registration book on daily basis in all our health facilities. That is all.
Thank you very much, Dr. Ibrahim. 2 more questions, one for Dr. Quresh and then a final question for Lydia. Dr. Quresh, I wonder, given the fact that there's all this fighting happening in North Darfur, but not only Darfur, right? There are things happening all over the country. How are you managing with the team to prioritize where we put our efforts, where we put our focus, and how we think about the resources and efforts around the country, given this widespread conflict?
Interesting question, and prioritization is really key right now, though almost every state is in need. However, we've set up a few measures in place as Relief International Sudan to make sure that we are prioritizing and delivering delivering services to areas that are really much needed, where they are much needed. One, we actively coordinate with the clusters for all the sectors that we support: nutrition, WASH, health, FSL, and protection clusters. The clusters have meetings that are done on a weekly basis. Of course, some maybe twice a week, and they always send out prioritization matrices every month. So those are very key for us to understand which areas are very, very important in terms of needs as per the cluster context or cluster information. The other point we have tried to incorporate into our plans is trying to be on so many steering committees as part of the Relief International staff. So with this, we are able to get more information in terms of need and in terms of where services are much more needed. The other point is our coordination with the Humanitarian Aid Commission and the state ministries of health. Of course, for any project site that we operate in, we make sure that we sit with the Humanitarian Aid Commission and the state ministries of health, and they provide the areas that they feel like there are so many gaps and the needs are dire. So we've tried to use some of those mechanisms to make sure that we do not implement activities in sites that might not be of high priority for the beneficiaries in the communities.
Dr. Quresh, thank you so much. That's a great view into how important that coordination piece is for the humanitarian work we do around the world. Thank you so much. Well, Lydia, finally, a question for you. As you said, 20 years ago, you worked in Darfur. You've worked in so many emergencies around the world in your career for a long time. That's not a reference to your age, but rather to your depth of experience. I wonder if you could put this humanitarian situation in Sudan in some context. This is a huge conflict. This is a huge challenge for organizations like Relief International. Where do you place it in terms of what's happening in Gaza, what's happening in Ukraine? Contextualize that a little bit for us, if you would.
Thanks, Craig. So what I would say is that Sudan is devastating humanitarian crisis simply because the whole country is in crisis. The whole country is in conflict. What we tend to see in other parts of the world where there's ongoing conflicts, they tend to be maybe isolated or happening in specific pockets of the country. There are some parts of the country where there is access, you can move around and still be able to provide some services. The challenge with Sudan at the moment is that there is no access. There's limited access to the whole country. And there's over 25 million of the population who are at risk of starvation or already suffering from hunger. So that's beyond what you'd find in most ongoing as well as protracted crises, where even when you see the crisis for Sudan in neighboring countries, the number of refugees that continue to cross the border to Chad and also to South Sudan, and even I've seen the impact in neighboring countries. And just seeing how the conditions are in the neighboring countries, you can almost imagine how worse it is in Sudan itself, where there is no access and there's difficulties to get in supplies to be able to provide assistance. So I would say in comparison, it's also one of those crises which is really underreported. You don't get to hear a lot on a lot of the media, the main media outlets that would be reporting as much on other crises as we've seen in the case of Gaza and Ukraine, and also during Syria, we managed to receive a lot of reports. So it does go as an underreported crisis is what I would say. So whilst it is on the radar of the international community, in terms of funding, it's still one of the significantly most under-resourced responses or crises at the moment. So that's what I would say right now.
Thank you so much, Lydia. And also a huge thank you to you, Dr. Quresh, Altagani to you, and Dr. Ibrahim to you. Thank you so much for not only being part of this conversation today, but for the incredible humanitarian work that you all do day in and day out. Please give our best to our teams who are on the front lines of this conflict in Sudan. And for all of you tuning in, thank you so much for your questions. I'm sorry we didn't have a chance to get to all of them. Great questions, everyone. But thank you for your support of Relief International, and have a terrific day, this being World Humanitarian Day. Thanks, everyone, for joining us. Bye-bye.